Hello, my name is Meg Huang. I'm the Executive Director at the Center for Connected Health Policy, the federally designated National Telehealth Policy Resource Center. For today's video, which is being recorded on July 27, 2022, we're going to talk about the 2023 proposed physician fee schedule telehealth policies. A few disclaimers before we get started. Please know that any information provided in today's talk is not to be regarded as legal advice. It is strictly for informational purposes. CCHP always recommends that you consult with legal counsel if you are interested in a formal legal opinion. Also know that CCHP has no relevant financial or interest arrangement affiliation with any organization related to commercial products or services if I happen to mention such a company or show such a product during this talk. A few things as we get started here for those who are not familiar with what the physician fee schedule is. So the physician fee schedule is really the proposed changes that CMS, the Center for Medicare and Medicaid Services, will be making to the Medicare program for the following year. They come out with a proposal every year around July of the previous year that they're going to make proposals for. And then they have a 60-day period where the public can comment on those proposals, and then they finalize them towards the end of the year, usually around November. There have been times where they've been a little bit late, so it's been extended out to December. But essentially, you will have like a finalized idea by the end of the year what types of policies will go in effect for the following year. And unless they did it for a future date, usually these policies go into effect on January 1st of the following year. So for the 2023 year, CMS came out with their proposals. They call it the unpublished version on July 7th of this year. What that means is the unpublished version is that it has not been officially published in the Federal Register yet, but the proposal or the document that came out is final as far as its content. So the published version will appear in the Federal Register on July 29th, so 2 days from today when this video is being recorded. And that date is important to note because that's when the clock for the 60-day comment period starts running. It runs from when it's published. The official version is published in the Federal Register, not from when they release the unpublished version. So in this particular physician fee schedule, if I were to sort of like categorize what was sort of the theme or what were the majority of the proposals that CMS made for telehealth for 2023, I would say really their sort of theme was more about clarifying basically what's going to happen if the public health emergency is declared over, what happens in that 151-day grace period that Congress gave to some of the temporary telehealth waivers that were made in COVID. So what CMS did, sort of their overarching larger policy pieces, they clarify that during that 151-day grace period after the PHE is declared over, that those lists of services that were temporarily eligible to be provided via telehealth, that list of services, it's still going to be operative, or it will still, you could still provide those services, all of those services during that 151-day grace period. When Congress created the 150-day grace period, they left unanswered what will happen to some of the temporary telehealth waivers, and the eligible services list was one of those things. So here in the Federal Register, CMS is clarifying that, yes, that is something that is going to stick around for the 151-day grace period. All these services that we allow to be provided via telehealth during the pandemic are going to be around as well for the 151-day grace period. They also acknowledged and said that they would abide by Congress's direction that during that 151-day grace period, other policies that were supposed to come in and be permanent and go into place after the PHE will be also delayed during that 151-day grace period. And these policies were really particularly around mental and behavioral health and telehealth. Congress had passed an act back in December 2020 called the Consolidated Appropriation Act, where they said as permanent Medicare policy, you can provide mental and behavioral health services in the home without meeting one of the narrow restrictions or one of the narrow categories that existed before. They said basically whatever eligible mental and behavioral health services that CMS covers with telehealth, you can now provide those in the home if certain conditions are met. And those conditions included something like a meeting with the patient in person before 6 months before the telehealth interaction takes place. So Congress said in their previous in the Budget Act for this year, 2022, that's going to be delayed for the 150-day grace period. And CMS said, like, yes, that's going to happen as well, too. They're just reconfirming that. Also, in last year's physician fee schedule for 2022, CMS had also allowed audio only to be provided for mental and behavioral health services, again, if certain conditions were met. And they also redefined what a mental health visit meant for FQHCs and RHCs to allow them to be able to use live video and audio only as well to deliver those services if certain conditions were met. Again, those policies will be delayed during the 151-day grace period. One other thing that was a major move that was proposed here in the proposed physician fee schedule for 2023 is that CMS moved more services from that temporary telehealth eligible list that was put out for COVID into category 3. For those who are not familiar, there are 3 categories for telehealth that CMS has. So these category 1 and category 2 are essentially tests for them to decide whether to move a service over to the permanent eligible list for telehealth underneath the Medicare program. A category 1 test is basically, is the service very similar to a service that's already on the eligible list? Category 2 test is there enough evidence to support the efficacy of providing that service via telehealth? So if a service passes one of the tests, either category 1 or category 2, it is then put by CMS onto the eligible service list, and that's the permanent list for Medicare where telehealth is concerned. 2 years back, CMS created something called a category 3. That's not a test, but more as a holding place for some of the temporary services from the COVID list, where they said all these temporary services, these services that we're temporarily allowing during the pandemic to be provided via telehealth that we will pay for, some of these we think have some merit to be put on the permanent list. But right now, at this point, they're not going to pass a category 1 or a category 2 test. But we think they just need more time, or we want more time to gather evidence to see if they essentially pass category 2, a category 2 test, before we move them over to the permanent list. So we're going to create this category 3 where we're going to take some of the codes, and not all of them, some of the temporarily allowable codes on that COVID eligible list, and put them into category 3. And they're going to stick around until the end of 2023, regardless of what happens with the public health emergency. So the public health emergency is declared over September 1st of 2022. These category 3 services are going to stick around, we know, until the end of 2023. And I said that they created this category 3 essentially for 2021. So what they did during this round of physician fee schedule proposals was add more services into that bucket there, into that category 3 bucket. So these were kind of like the major actions or major proposals related to telehealth that were in physician fee schedule, but there were a couple of other things as well too. So CMS is going to be adding to their permanent telehealth list. Right now, they don't have a number assigned to it. That's why you see the GXXX1 to GXX3. These are to replace prolonged services codes, and specifically 99356 and 99357. They don't have a number assigned to it yet, but they're going to add those to the permanent telehealth list. So again, when the public health emergency is declared over, it doesn't matter if these codes are going to stick around. So that's on the permanent telehealth list. They also clarified, because there's been a lot of interest of adding telephone EMM codes 99441 and 99443 to category 3, to that temporary holding bucket. But CMS said that we're not going to be doing that. We're going to assign them a bundle status, and they will be around a bundle status for after the grace period. So they are around and active because they're temporary for that period, but they're going to get a bundle status. They're not going to be a permanent code, or they will not be in category 3 either. So during the grace period, they also clarified that For billing purposes, the 95 modifier should be continued to be used, but afterwards, when you're billing for telehealth delivered services after the 150-day grace period, you're to use to place the services codes, either 02 or 10, whichever is appropriate. And they also clarified that beginning January 1st of 2023, that if you're doing things via audio only, to use the modifier 93, so they know that you did it via audio only. Earlier this year, CMS had come out with directions to FQHCs and RHCs and OTPs for when they're using audio only to provide mental health services to use the modifier of FQ, but they're proposing to change that and direct them to use 93 instead. And that was really more to be consistent for what they're telling other providers to do as well. A couple of other things. So opioid treatment programs, that's what OTPs are, will be allowed to for intake add-on codes to be furnished by telehealth, and then or live video at least. And if live video is not available, they can use audio only. But when they bill for this, and it's only for the initiation or treatment of buprenorphine, and only to the extent authorized by the DEA and SAMHSA. So that's still like a little bit up in the air, because we don't know exactly like how far the DEA and SAMHSA will authorize this at this point, but they're allowing this opportunity for telehealth to be used on that particular for intake, but also only for buprenorphine when you're talking about treatment with buprenorphine. The facility fee for 2023 will be $28.61. They are also adding more remote therapeutic monitoring codes. That's GRTM1 to GRTM4. And then there was also another temporary measure that was allowed during that pandemic, and that was around direct supervision using telehealth when you're doing diagnostics tests, physician services, and some hospital outpatient services. CMS clarified that this is something that's not going to be around during the 151-day grace period. So I said earlier that Congress had addressed some of the telehealth temporary measures, and then like CMS clarified some other ones. There were still some temporary telehealth policies that were made during the pandemic that so far nobody has really talked about. One of these things is, for example, the relaxation around HIPAA as well. So we don't know if that's also going to stick around for the grace period. CMS is clarifying that one of these other policies, the one on direct supervision, is not going to be around for that 151-day grace period. So keep in mind, when the public health emergency is over and we go into the 151-day grace period, right now, as far as like what we know about the policies going forward, not all of those temporary telehealth policies will also be in effect during the 151-day grace period. So just be aware of that information and that fact too. There were a few other things, but if you want like a deeper dive into the proposals, please see the CCHP fact sheet, which is linked right there and is available on our website. This is also where our website, our URL is for that. And please know that we also have a newsletter that you can subscribe to as well to get the updated and latest information regarding telehealth policy throughout the country. And that is some contact information. So I hope this was helpful for you. I really encourage you also to go look at the fact sheet. It does give like a deeper analysis on what these proposals do or are saying. Keep in mind, right now, they are in a proposal state. So there's an opportunity for the public to make comments on what they have proposed, and then they will be finalized later at the end of the year. So they're not set in stone yet. So there is an opportunity, if you would like to provide your input to CMS, for you to do that starting July 29th of 2022. Thank you very much. I hope you have a great day, and we'll see you in our next video.